In this video, I am going to teach you what happens in a herniated disc, the two main types of herniations, and how the type influences our pain. Let's start out with what a herniated disc is. On imaging, it will look like this, and what is happening is that the ligament-like outer layer called the annulus fibrosus becomes disrupted. By that, I mean it gets weakened, torn, etc. And when that happens, it allows the inner gel-like nucleus pulposus to squeeze out of that weak point. The specific area and the direction the disc squeezes out influences the symptoms we have, as does how far out the disc herniates. Now, this is one of many reasons why some disc herniations cause absolutely zero problems, while others give issues like pain down the leg, i.e. sciatica, and even weakness of the muscles in the leg. Because if a large herniation pushes out but avoids the nerves, it will not cause your leg weakness. But a small one that hits the nerves just right might do so. But why does a herniation even happen in the first place? We can broadly split it into two different causes, and both are going to show up a little differently. First are degenerative chronic herniations, and second are acute traumatic herniations. Let's talk about the degenerative ones to start. This herniation happens slowly over time, but correlates best with older age. Because what happens is that as we age, our annulus fibrosus slowly becomes worn down and weaker, just like many things in our body. And this makes it easier for the disc to then herniate out. So as we go from 40 years old to 50, our annulus will slowly weaken, and that will allow the disc to gradually start pushing out against it. Then as we continue aging from, say, 50 to 60, it will weaken, and the disc can push out further and further and further over time as we get older, until eventually it results in a herniated disc. Importantly though, age is not the only thing that weakens our annulus. Lifestyle choices like smoking and just our overall health also contribute, though aging is likely the biggest factor and is definitely the one that's easiest to understand. Now let's go ahead and talk about the second type, that acute traumatic herniation. This is what happens when you hear of someone slipping a disc when lifting a heavy object, squatting, deadlifting, etc. Instead of that degenerative herniation that just happens slowly as we get older, this acute herniation is a sudden, sharp change. It's thought that the acute herniation happens because a sudden spike in force or pressure becomes too much for the annulus to handle and keep the pulposus intact inside. Here's an example. Let's say you are squatting 500 pounds, but you accidentally twist kind of funny. That twist can shift most of the force over to just one side of the disc, rather than distributing it equally throughout, as was probably the case when you were doing so, meaning squatting with good form. That sudden spike of force is way more than the disc has gotten accustomed to from your prior workouts where things were more equal. So it hasn't really built up the strength to manage it and manage that force. As a result, that annulus can fail and the nucleus pulposus can squeeze and push its way out. This same concept applies when lifting a couch, moving boxes, whatever else. Importantly though, the likelihood of having an acute herniation increases the more degenerated and so weaker our annulus fibrosus is. What that means is that the older or less healthy we are, the easier it is for us to get an acute herniation. Because of that, someone who's 50 will have an easier time herniating their disc if they put 500 pounds on their back than a 20-year-old will, just because the 20-year-old has stronger ligaments and connective tissue, so likely has a stronger annulus. So what is the implication of the herniation type for our pain? Generally speaking, if we have a degenerative chronic herniation that's happened slowly over 20 years, it is less likely to cause us problems than the acute traumatic herniation. And there are two main reasons for this. First, if our herniation happens slowly over 20 years, then the body is often able to compensate and adapt to that change, though it isn't always able to do so, as in the cases where the herniation heavily compresses a spinal nerve, because nerves don't adapt as well. Second, when it happens slowly over time, there's less of a sudden inflammatory response by our body. This is a lot different than the acute herniated disc where there's a sudden injury and going with that, the body has a sudden spike in inflammatory chemicals because you just had a sudden injury. And those inflammatory chemicals are a major factor in us experiencing pain, and is much of why those acute traumatic herniations tend to hurt a lot more than the chronic ones. To wrap up, the key things I hope you take away from this video is first, that not all disc herniations will give you pain or problems, meaning they are not always an issue that we have to fix. Second is that not all disc herniations show up the same way. The pain or symptoms we get depends on where exactly the herniation is, where it's located, and whether or not it pushes on a nerve. In future videos, I will expand a lot more on the types of herniations, how we treat them, the recovery timeline, and so on. So keep an eye out or subscribe if that interests you. Thanks for watching, and good luck with your recovery.